Today we had the Reticon meeting. This is a meeting which is dedicated only to the diseases and problems of the retina. So it is not as uncommon as we think. Retina problems can happen even in a 1-month-old child to even an adult. So we have covered all the spectrum of problems today in this meeting. Even how to do surgery for retina problems in a 2-month or 3-month-old child, as well as how to give treatment for age-related macular degeneration, which happens in the older age group of 70 to 80 years. And most importantly, we know that diabetic retinopathy is increasing. Almost 30% of patients who have diabetes can have the problem in the retina also, in the eyes. The patient doesn't understand it because externally the eye may look normal. So the regular checkup pannu. So every patient should have regular checkup done. Then only we can find out the diseases of the diabetes which can affect retina. In fact, under the Agarwal group of hospitals, we are doing regular diabetic retinopathy screening. So just like we do screening for the glasses and everything, we now have special cameras where without any special gadgets, we can take photograph of the retina. We can check whether diabetic retinopathy is there or not. Because by the time the patient will know, permanent damage to retina will have happened and we will not be able to improve the vision of the patient. So it is very important that this awareness is there amongst all people, that patients should also know, the doctors should know, more and more doctors know it. Here that we do the teaching of not only the patients but the doctors, that how the retina should be examined and treatment should be done well on time to prevent blindness.
It's only surgery, madam? Retinopathy is only surgery or medical?
Medical treatment also can be done, laser can be done, injections can be given, but some situations serious and complicated surgeries will be required. So here we have covered all the aspects. How to do even complicated surgeries were taught here on a video-based session and by the very famous and authentic doctors of the country. Best of doctors came. Almost 40 doctors came from across the country in this conference, and it was physically attended by more than 600 to 700 delegates who were here to see the meeting and learn from all these videos and their experience, which is some of the doctors had more than 40 years of experience in this line.
What is Dr. Agarwal Eye Hospital is the number one in tackling the surgery of the retinal surgery among the all other hospitals.
We have the best of doctors available who can do any kind of surgery for the retina which may be required for any patient.
The retina clinical test is affordable?
Yes, sir. It can be done by a simple examination and no extra gadgets or anything is required. We can put drops and dilate the pupil, and in fact they say the eye is like a window to the whole of the body. This is one place in the body of humans where we can actually see the blood vessels, where we can see live as to what is happening. Like we will say, heart patient solvanga, the blood vessel block aichu. The heart less paak mudiyadu. Indirectly, angioplasty and all those things we will do. But here in the retina, if we know how to examine, we can actually see these blood vessels and treat them very effectively.
How much it costs?
சார் இது வந்து ரெகுலர் ஐ டெஸ்ட்ல நீங்க போனாலே கண்டிப்பாக ரெட்டினா செக்கப்பும் சேர்த்து தான் பண்ணுவோம். ஸோ கண் பார்வை செக் பண்ற மாதிரி கண் பார்வை, பிரஷர், நரம்புன்னு சொல்றது வந்து ரெட்டினா தான்.
What is the message you want to give to
find out the retina problem in the womb itself?
Yes, we can do that, but that is not required in all cases. For special cases like genetic problem irka, adha madri irkada, apram genetic testing pannittu adha madri.
Retinoblastoma is a cancer. Other, if your parents irundhu ஒரு சைல்டுக்கு இருந்தால் செகண்ட் சைல்டுக்கு they can do genetic testing and also do test பண்ணி they are usually advised to abort because if they have a precious child then we have to treat that intrauterine. It's possible.
Actually, you said 25,000 retina specialists.
25,000 ophthalmologists are there in the country, out of whom 1,600, 1,700 are who are retina specialists. So that means less than 10%.
Why the gap is so?
Because that awareness and excitement.
Retina is like the film in the camera. You cannot see the retina. So it is difficult to examine and difficult to treat. And as you said, treatment-wise we need a lot of equipments. But diagnosing, you can use a simple indirect ophthalmoscope or ophthalmoscope. But we use indirect ophthalmoscope.
I'm asking why the people are.
So there are many specialties.
It's a backtracking
One of the
specialty
specialties.
because every surgery will take time. every patient it
லேர்னிங்
takes time.
கர்வும் வந்து பாத்தீங்கன்னா இப்ப கேட்ராக்ட வந்து ரொம்ப சீக்கிரமா கத்துக்கிற மாதிரி ரெட்டினாக்கு வந்து அவ்வளவு சீக்கிரமா கத்துக்க முடியாது. அதுக்கு லேர்னிங் கர்வ்னு இருக்கு. ஒரு யூசுவலா வந்து ஒரு ரெட்டினா கத்துக்கிறதுக்கு ஆஃப்டர் தியர் மாஸ்டர்ஸ் ஆப்தமாலஜில அவங்க மாஸ்டர்ஸ் முடிச்சதுக்கு அப்புறமா ஒரு 2-2.5 வருஷம் வந்து ரெட்டினாக்கு மட்டும் ஸ்பெஷலைஸ் ஆயிட்டு தான் they can start to practice. So it's a long drawn இது.
What is the message you want to give, madam?
அதனால தான் problem.
Message you want to give the common people.
To the common people.
Yeah, to the
Don't
conference.
ignore your retina. Retina is the film of your eye.
Correct.
If that film is damaged, there is nothing that can bring it back. So don't ignore the retina. If you have diabetes, if you have any condition that impacts the retina, please go to the hospital at least once a year to get thoroughly checked up. Once an ophthalmologist or retina specialist has visualized your retina and given you the clear, you can visit next year. But don't ignore it because it's a nerve. Once damaged, you can't bring it back. That is the biggest problem with a nerve.
And diabetes is a lifelong disease. So every year, as Asha said, the message should go to the people is every Indian should get the check right from birth to death, and even after the death, they should contact the eye hospital for donating their eyes.
Thank you so much.